Hello everyone. Today's video is on Medicare supplements in Massachusetts. Hello, my name is Mike McHugh and I own MedicareMike.org, and I'm making this video today because I get a lot of questions on supplements in Massachusetts since we have a different benefit structure than other states. So I hope this brief video today provides the information you're looking for. And the agenda for today's video is as follows. We're going to briefly go over what a Medicare supplement is and also what it is not. We're going to go over original Medicare. I'll give a brief overview of the costs and the benefits. We'll go over how Medicare supplements are different in Massachusetts than other states, one of only 3. And finally, we'll go over how to choose a Medicare supplement if you need one at all. And we'll start with the basic question, what is a Medicare supplement? A Medicare supplement supplements original Medicare, so to speak, or it enhances the values of original Medicare A and B. You'll also see it referred to as Medigap, and you'll see that supplements come in different benefit levels and prices and shapes and sizes, and you should really do your due diligence on which supplement is right for you as you head towards your IEP or as you consider changing plans. Many folks find themselves asking if they really need a supplement. So what I'm going to do here is go over a very brief overview of original Medicare so you can ask yourself that question again to discover if you really do need it. Original Medicare Part A and Part B both have premiums. Medicare Part A has a $0 premium for almost everyone, assuming you paid taxes for 10 years or more in this country. And Part B is income-based, and the standard 2021 Part B monthly premium is $148.50 per person. Now, this is income-based, as I said, so the link below this screen should link to Medicare.gov, where you can look at the income brackets to determine your Part B premium. You'll also see that both parts have deductibles. Medicare Part A has a tricky deductible. The annual deductible for Part B is $203, which is simple enough to understand. It's an annual deductible. But for Part A, that $1,484 deductible is actually per benefit period. And a benefit period essentially starts when you go into the hospital or when you're admitted, and it lasts 60 days after you leave the hospital. So after that happens, if someone is readmitted to the hospital, then that Part A deductible can come back and you could end up paying it multiple times in a calendar year. After the deductible, generally speaking, Part A and Part B will cover 80% of both your inpatient and outpatient expenses. This is a general rule, and for more detailed information on what A and B cover, I suggest you look at your Medicare and You handbook, or you go to Medicare.gov for a full list of services because they are comprehensive, and it should be part of your Medicare education, at least as you're starting off in Medicare, trying to gather all the information and understanding what covers what. So you really want to think about how much exposure you really want to have, because even with those big deductibles, 20% of an inpatient stay could be a lot of money. And it's a situation that I seriously doubt that you want to be in or anyone wants to be in. So now we're going to get into how Medicare supplements are just different in Massachusetts. We have a plan structure that's just very unlike other states. If you've done any research, you've probably realized that supplement plans will range from A, B, C, D, all the way through L. Whereas in Massachusetts, we really just have 3 types of supplement plans, and they all work a little different. We have a core plan, we have a supplement 1A plan, and we have a supplement 1 plan. And each plan will work with Medicare in a different way to help address the gaps. You could almost think of those plans as small, medium, and large as to how much they're going to help you when you start incurring Medicare charges. Massachusetts is also a guaranteed issue state, and that's important because you hear a lot about people being denied for pre-existing conditions or being unable to go through underwriting for one reason or another. And in Massachusetts, that doesn't happen. These products are guaranteed issue, which means a couple things. The first important part is that you can't be denied. If you decide you need to switch your supplement plan down the road or another type of plan, you can just change it, assuming you have a valid election period, and you are guaranteed to be approved. And the other thing we have here is community ratings, which means everyone pays the same price. No matter where you live, what zip code you live in, or how much money you make, you're going to pay the exact same price for your supplement without any questions. Also, You have statewide availability. Now, this is not so uncommon to just Massachusetts, but in short, whether you live in Provincetown or whether you live in the Berkshires or anywhere in between, you can get approved for the same products no matter where you live. All supplements are available all over Massachusetts without exception. And finally, one more part that is not unique to Massachusetts that you should understand is that supplements are not subject to open enrollment period or annual election period. In other words, you don't need to wait until October 15th to change your supplement plan. If you decide that in the middle of the year you need to change your supplement plan, you can do that, and the new change will take place the first of the following month. So really, as you start to think about which Medicare supplement you want to choose, if one at all, you really want to start to take a step back and think about your own situation, because where you start matters. The answer for everyone is different. Everyone's situation has entirely different variables, and whether or not a Medicare supplement is right for you is something that you really need to do the work on to figure out if this is something that'll benefit you as you move forward in your Medicare years. You need to determine the amount of financial risk that you're willing to take with each product, because the more you spend in most cases, the more coverage you receive, but at the same time, you're spending a lot more money. So that's something you really want to take into careful consideration. You don't want to ignore this topic. That's one thing. I see a lot of people that will come here, they'll get information, or we'll get on a Zoom call and they'll get information, but then they won't do anything because it feels like they kind of addressed the issue. Don't do that. If you do that, you'll start incurring penalties. Penalties is a topic that I'm going over on another video. We made a Medicare checklist system or guide that I've mentioned in other videos, and that's downloadable below this video, and I encourage you to use it, as it helps you kind of move through the thought process of choosing a Medicare supplement plan, whether it's a supplement plan, an Advantage plan, or staying where you are. This checklist system is intended to help guide your thinking as you move through this, because I realize if you're approaching 65 years old or you just got onto Medicare, this is a complex subject. So the checklist system is meant to help you kind of move through the thought process and remove some of the stresses that you might have been enduring up until that point. And finally, the last thing you can do is you can speak with an advisor. I hope you'll call our office and set up an appointment personally. You'll deal with me or Mary Beth. Our number here is 617-932-1200, and you can email me. My direct email here is mike@medicaremike.org, and the reason you might want to speak with an advisor is that it's free. All day, every day, this is all we do. We help people understand Medicare, understand their own situation, and then make the right plan decisions moving forward. And as your servicing agent, it's my job to help you go through that process. So I hope you'll set up an appointment, and I hope to speak with you soon.